Andy Oram, reporting for Health Innovation TV from the Health Datapalooza, more recently known as the Health Data Forum. And I'm with Fred Trotter, who was one of the leading hackers in the field of programming in healthcare. And now Fred has embarked on a new venture called Hacking HIPAA.
So hacking HIPAA is a concept that David Harlow, Ian Aslick, and a bunch of other people came up with at the last Foo Health. And the basic concept is that we recognize that HIPAA fundamentally is a good law. It did good things and overall has had a positive impact for patients. However, HIPAA had a lot of unintended consequences. People react to it in very strange ways. The federal government has made clear with not one but two, for instance, not one but two places where it specifically says that plain text email is okay for patient-provider communication. Despite that, the in the field reaction to HIPAA is that there is no emailing your doctor, right? So what the problem with HIPAA is unintended consequences. So what the concept we came up with is, could we find a way to hack essentially the responses to HIPAA? And the prompting for this was our realization that the HIPAA omnibus rule, which I think comes into effect in September, will make essentially the traditional approach to hosting HIPAA-covered data in the cloud illegal. Now, of course, that's not technically true, but practically it is true because Rackspace and Amazon, unless they both change their policies, you won't be able to host HIPAA-covered data there because they don't sign business associates agreement in the cloud right now. That's the problem as of today. Now, we're working with Rackspace and to a lesser degree Amazon to try to fix some of those problems, but what we've realized is that if we go to the root of the problem is this. When an individual healthcare provider goes and hires a lawyer to write their HIPAA documents, they create expectations in their patients and create a contractual relationship with their patients where they waive certain HIPAA rights and not other HIPAA rights. And so when I, as a technologist, am going in to build innovative things for patients and I want to sell given innovation to different provider organizations to provide to their patients, I have to do a little bit of technology to stack over and this provider, and oh, that provider doesn't use SMS because they can't do that because of their policy, and oh, this provider doesn't do plain text email, or this provider doesn't do that, and this provider doesn't do this. So what you get is a situation where the patient gets the worst of both worlds. Patients get no innovation, and they also get on standard poor security in their systems, right? Because we don't have innovative systems coming in where we can improve security, and we generally have no innovation either. So they're not winning. Because we have privacy, it's not like we get privacy. We don't get that either, right? So the current reaction is worst of both worlds. So what could be done? The fundamental document that a healthcare provider makes with that forms the relationship between a patient and provider regarding HIPAA is this Notice of Privacy Practices. It's a document that you sign when you first go in and sign your doctor. So what we've realized is we need a Creative Commons type approach to this. We need, in the same way you have a standard open source license or a standard document license like Creative Commons or something else, we need a standard agreement between a patient and a provider with reasonable defaults, meaningful choices for patients about how that relationship is going to work. So, for instance, let's say, let me ask the interview. Would you like to email your doctor?
Yeah.
Okay. Would you feel comfortable with your private health information going back and forth over SMS?
I'll say no.
Okay. So you knowing a lot about what SMS is and what plain text email is, you want to do this, but you don't want to do that, right? It's a perfect kind of answer. So what we want to do is have a document that says, let me go back and ask you a third question. Rather than plain text email, would you feel like it was worth your trouble to create an encrypted email connection to your provider?
I'll say okay.
Well, do you want to do that instead of plain text, or you want to do both, or neither?
I'll say just the encrypted.
Okay, just the encrypted. So I would feel much more comfortable. I feel like I just want to email. I just want it to work. And I use a Gmail address, and I'm comfortable with the security there. The question is, why can't you get what you want, and I get what I want all at the same time? Right? So when we both go into a doctor and we sign away something, there should be something in that relationship that we have with the provider that allows me to get, I'm cool with SMS, plain text email, phone call, pigeons, whatever they want to do, I'm good with, right? I don't care. I publish my healthcare data online. I'm not a privacy. You want mixed, right? You want some things private, other things not private.
Is it easier to set up a technological system that allows plain text email, or is it easier just to install SMIME everywhere?
That's the thing, is there's 6 or 7 different ways to communicate with patients on the current meaningful use. We've got Direct Project, we've got portals, we've got things that look like Direct with Blue Button Plus. There's lots of options. Smart Platform, there's great stuff out there that meaningful use approves of, and is stuff that you can create secure communications with patients. Now that's really good, because what it means is, now that we have those secure options for communication, we should be able to give a meaningful choice to every patient in the country that says, if you want to do plain text email, that's fine. If you want to do secure email or have a secure option of some kind, that's fine too. You don't have to choose, right? So, or rather, you don't have to choose one or the other. You can make a selection between both. We're not going to dictate what you get, right? So in order to do this, though, I as a technologist need to be able to rely on the fact that all the patients have gotten basically the same deal. Like, they're all okay with a certain structure. And so it's very simple. If you SMS your doctor, that means you're okay getting SMS. If you plain text email your doctor, it means you're okay getting plain text email. If you say stop to the SMS, or you say stop and reply to an email, then the system will stop, right? Or so we're not sure exactly how it'll work, but in general, there needs to be a very clear structure that's repeatable, that can be standardized for how this interaction should take place. So what we've done is we're going to do a crowdfunding. I've been very successful with crowdfunding on MedStarter, very pleased with that platform. So I recommended that platform to David Harlow, who's our legal representative, is one of the top healthcare lawyers in the country, who's going to be collaborating. And the basic way it's going to work is this. We're going to create this new document. It's going to be like a Creative Commons document. It's going to be a standard way to do this particular process. He's going to author that document. If you have $1,000 that you want to put in, you get to talk to him about what you want. Right? If you put in less, you can use the document, right? But if you want to actually get a say in how it's formed, then you put in $1,000, and he'll listen to you as he makes this document. We're going to focus on New York, Texas, and California to begin with. We need extra funding if we want to do more states. There are a lot of variations in state law that you have to account for these kinds of things. You can't just obey the federal law. You have to obey all laws. So in general, though, what we're going to do is crowdfund an approach that should fix HIPAA to give options for technical choices.
And I suppose the document will evolve over time, like all these other technologies evolve. So
actually, and again, I can't promise this because we're still making some of these decisions, but right now what we're planning on doing is releasing the first version as an open source document, which means it'll literally be under the Creative Commons as it imitates the Creative Commons. And so what people will be able to do is take the document and vary the document, because we want people to say, well, if you want to use it in an academic environment, they're going to need to modify it to make that happen. Version 2 will probably not be modifiable. So what we're going to do is essentially use the capacity to fork under certain licenses to find out what the community actually needs in terms of these documents. And we're going to see if we can back end the whole thing with GitHub. So literally we're going to have this document being forked all over the place. And then we'll do a massive merge. And version 2, again, I'm not promising, but in general, the idea is that version 2 of this document will be something that will incorporate all 50 states, academic considerations, IRB considerations, multiple different privacy laws, multiple different privacy perspectives, including everyone's preferences or everyone reasonable's preferences about patient privacy. So we're basically going to use the open source community to develop a legal document to fix this problem, which is how we're going to hack HIPAA.
Well, I figure that if this starts to get adopted, the doctors will feel much more comfortable with doing what the law requires, and patients will become comfortable with it too.
Well, that's the thing, is it's so often HIPAA is used as an excuse for patients to not get their data, which is a tragedy, since built into the law from the get-go was always a patient access right. But because people misunderstand what the obligation is, it's used in the opposite way. So if we have a document where the patient can go in and say, you made me sign this and this says I have these rights, why would you be now trying to pretend like I don't have these rights? This is the thing you gave me. So we hope to reduce the amount of business that healthcare lawyers get a little bit, to write everybody's document version of this. We want to have a standardized agreement here, and we think that will help health IT innovators like me be able to offer consistent solutions that are HIPAA compliant.
Well, thank you, Fred, and thanks to David, too, for this project.
Yep.